Ow! A burn! We need immediate action. First, get safe and cool the burn. Rinse for several minutes, but if not near a water source, use whatever you have. The textbook says not to use ice, because it could damage your skin. But let's use common sense here. 1 minute of ice exposure won't give you frostbite. Then, use a dry, loose dressing to protect it, because we don't want any tight or adhesive sticking to burnt skin. Hospital or not, here's the deal. A 1st-degree burn is just redness. Keep it clean, use aloe, and rest. You're gonna be okay, little fella. A 2nd-degree burn is blistering. If the blister is the size of your palm or larger on your face, hands, feet, joints, neck, or places you don't show other people, you need to go to the hospital. There could be healing complications that result in long-term damage. Any 2nd-degree burn the size of 5 of your palms or bigger, go to the hospital. There could be lots of problems, including death. Also, any 2nd-degree burn that wraps all the way around a body part, definitely go to the hospital. If your 2nd-degree or blistered burn is smaller than your palm and you can treat it at home, be sure not to pop a blister. It's nature's Band-Aid. Keep it clean and use either aloe vera or manuka honey. Studies show that they are both very powerful for healing, even compared to antibiotics. 3rd-degree burns are deep and charred and often don't blister. Any one of these needs to go to the hospital. Burns involving the airway. Did Dad try to light the grill and it go poof? If you notice singeing or discoloring around the mouth or throat, or the patient even mentions scratchy throat, hard to swallow, or pain, you need to go to the ER right away. The airway could seem okay and then rapidly swell shut. And what about electrical or chemical burns, you ask? Any electrical shock that causes a burn needs to be evaluated at a hospital, especially if there are burns in 2 places, like both hands or a hand and a foot or leg. This is because the electricity has traveled through the body and may have caused serious damage that you can't see. Chemical burns, like bleach or acid, use lots of water and take off any clothing that got wet with the chemical. If you end up with a blistered burn from a chemical, head to the hospital. Dry chemicals you can try to brush off first, but be careful not to inhale it. Remove any contaminated clothing once again, and lots of rinsing with water. There are some rare chemicals that react badly with water, so always remember to check the warning label. For any chemical, you can always call poison control 24/7, 1-800-222-1222. And for more Kid Medic, always remember, do good, be good, share. Ow! Ow, a burn. Nope. A 2nd-degree burn. Wait. Oh. What was I supposed to say again? Blistered burn.
Berm?
I mumbled. A warning thingy.